This is Dr. Saaجد Maqbul again with some more information about fever. We had talked about fever in the last video, and I explained that there is a normal temperature which is 98.6. Now what I want to elaborate is that actually there is a range, and you could say that between 98.6 to 99.5 is the range in the average child, and we consider that normal. So technically anything above 99.5 is fever in children older than 3 months of age. However, when it comes to newborns, then we are a little bit more careful, and up to 3 months of age we are a little worried about fevers even at 99.5, and therefore we need for you to consult your doctor if that happens. Especially in the newborn, the temperature should not be this much. And another aspect of fever in neonates or newborns is that instead of the temperature being high, it can also be low. And as a matter of fact, if the body temperature is low, especially lower than 37, then we are worried about infection just as much. So a low fever, a baby who's sort of cold, and especially if there are other symptoms, needs to be checked. The second thing that a lot of parents ask us about is what we call febrile convulsions. Now these are what we call fits or convulsions in children up to maybe 10 to 15% of what we call normal children. This happens in some families, and there is a tendency in families to have this. This is somewhat scary, but not as serious. So let me explain this. What happens in some babies is, especially those under 2 years of age, is that their nervous system is not as mature, and the response to the fever sometimes causes jerking of both hands, both legs, and sometimes the eyes turning up, especially when the fever seems to be high. Actually, it is the rapid rise of fever that causes this convulsion, and it's very frightening to the parents. Now, a word of advice is that you shouldn't panic. You should make sure that there's nothing tight around the neck of the child, and turn the baby to the side and let him or her be, and don't interfere. Don't put a spoon or a metal or anything or a pencil or a pen in the mouth. Do not shake the baby. Do not turn him upside down. Do not pat him. Do not throw water on him. Do not try to breathe for him. If you do turn him to his side, the convulsion goes away. Now you do, of course, have to get this checked by your doctor, and the doctor will be able to tell you whether this is what we call febrile convulsions or whether there is something more serious. So remember, febrile convulsions are common, and initially you need an evaluation by the doctor. Now if he feels that this is something that is not serious, he might prescribe some medicine, because there is a tendency for these children to get them again once they've had them. Sometimes tests need to be ordered, and of course then different treatments need to be given. You remember this again, and that is that the fever medicine must be given when a baby has fever, especially those children who have a tendency to have febrile convulsions. So always keep 1 or 2 medicines at home, especially paracetamol or ibuprofen, and very frequently this sort of an emergency happens at night, so you should be prepared. You should have made plans to give him medicine for fever. You uncover him, make sure there's nothing tight around the neck, turn him to his side, and try and take him to the nearest emergency room. Most of the time this will go away in a minute or so, but it seems like a long time. So fever generally, to reiterate, is a symptom. You don't need to worry too much about it unless the child has other symptoms which tells you that the child may have an infection. And in the rare instance where the child has febrile convulsions, you should be well prepared to handle it and be reassured. Thank you. We'll meet again with further clips.